Elevidys is a recombinant gene therapy for Duchenne muscular dystrophy. Elevidys makes it possible for the body to make a protein, Elevidys micro-dystrophin, that contains copies of important sections of dystrophin proteins that were defective in the muscles of the patients with Duchenne muscular dystrophy. Elevidys is given as a single intravenous dose for Duchenne muscular dystrophy. Patients that are 4 to 5 years old and do not have contraindications to treatment. How to use? Elevidys is a single dose, one-time treatment, given as an intravenous infusion. Before the Elevidys infusion, you will have your liver function assessed and other blood tests. You should not have an infusion while you have an infection. To reduce the risk associated with an immune response, you may be prescribed corticosteroids starting 1 day before the infusion. Warnings. Acute serious liver injury have been observed when using Elevidys. Before using this medicine, liver function tests should be performed to then monitor liver function. Clinical exam, GGT, and total bilirubin weekly for the first 3 months following Elevidys infusion. While taking corticosteroids, an infection before or after the Elevidys infusion could lead to more serious complications. Contact a healthcare provider immediately if symptoms suggestive of infection are observed. Coughing, wheezing, sneezing, runny nose, sore throat, or fever. Side effects. The most common Elevidys side effects in clinical studies were vomiting, nausea, liver function tests increased, pyrexia, thrombocytopenia. The following are clinically significant adverse reactions: acute serious liver injury, immune-mediated myositis, myocarditis,